Hi, welcome to the Healing Yoga Joint. Today I'm very honored to be able to bring to you Doctors Josh Funk and Craig Hauser of Rehab to Perform and Hauser Health right here in Frederick, Maryland. So I'm going to not butcher their backgrounds. I'm going to let them explain who they are and what they do and how they came down this journey. And but first I wanted to thank you guys very much for the time. This is invaluable. I mean, taking your time to share all your expertise with so many people, I appreciate it. So, okay, so Josh, if you don't mind starting, can you back away and.
Yeah, I think for me, from the area, I grew up in Montgomery County. I went off after being a multi-sport student athlete in high school to play lacrosse at Ohio State. I got injured my sophomore year, was able to avoid surgery as a result of going to physical therapy. Got me very, very invested into the human body and how it works and how it operates. And I went to physical therapy school, earned my clinical doctorate of physical therapy at the University of Maryland, and I've been practicing in this area for about 5 years.
Great. And I've been going to Josh or his office since they started. So it was Josh. Well, no, did Zach come on after? Were you by yourself? Were you solo for a little while?
Me and Zach. We started up the end of 2014.
Yeah.
Before Bailey.
I remember
right?
it was awesome. And the big thing that for me with going to physical therapy is it keeps me going. Where I have aches and pains. I have most of my issues begin in my knees. That's when I know things are starting to go south. And going to conventional orthopedic, there's nothing structurally wrong, and they want to give me a pill. Same thing that has happened to everyone else, right? And they say, hey, take this pill, and that doesn't help, and you're still in pain. So they figure out mechanically what we can do and how to keep me going. So that's the Josh part of it. And then Dr. Hauser, please.
So I'm an integrative and functional medicine doctor, and how I got to that point, well, I graduated from medical school back in 1994 from Uniformed Services University, which is the military's medical school down in Bethesda, which is the circuitous route of how I ended up back here. And I practiced Western medicine for, I've been an MD for 23 years now. So primarily practicing that way, but about 10 years ago, I had my own health issues. And things started breaking down in my own body, and I had to go back to school because my primary care physicians weren't able to treat me and solve my issues. So I studied with Dr. Andrew Weil out of the University of Arizona down in Tucson for 2 years, and I did a fellowship in integrative medicine. And then I've trained with other specialists for various amounts of time to learn what functional medicine is. And after fixing myself and getting better, I finally decided to set up Hauser Health, and here we are.
Awesome. So I have a list of questions. We're going to start with the questions that I came up with, and then some of the subscribers had questions, and we're going to go with these first. One of the big things, and I know that you believe in this as well from a performance athlete and just a human performance, and I know I'm sure you do as well. What you put in your body makes a huge impact. It's not all about taking a pill and getting the inflammation down, because I know personally that didn't do anything for me. So what is your perspective? Because I know I was having an issue with something one time when I was in your office, and I asked you guys, and they gave me a sheet. You guys even have something that you share with your clients about beating inflammation naturally.
Yeah, there's 2 different sheets that we'll give people. One will be just general suggestions with regards to nutritional recommendations, where you can eat things or use certain supplements that have been proven to be more anti-inflammatory in nature. And then there are certain things that happen when you have a surgery where your body demands a little bit more out of you, and things that kind of kickstart and help your body be in a better position to heal quicker. I think that's something probably, Craig, you can probably get a little bit more into the details of that, but that's something we've had a lot of success with. And some of those situations, even where you've had people who've had maybe some chronic issues with regards to swelling or discomfort, and sometimes making nutritional changes, really, really does make a big difference.
And you deal with a lot of people post-surgery.
Yes.
Yeah. Injuries or knee replacements? Is it everything? Or do you see more injury related, like athletes, or somebody took a fall, or are you getting people in there, I got my knee replaced because I had such bad arthritis and I'm coming in?
Yeah, we get everything from, whether or not it's total joints, I'd say ACL injuries are a big part of what we do, labral tears, shoulder sprain, kind of like a shoulder surgery, ankle surgeries. And then, your more acute injuries, your on-field injuries, your during a running race related injuries, your CrossFit, boot camp fitness oriented, overuse injuries that sometimes pop up. So it's a pretty wide variety.
Okay, great. And what about you? Diet. You have to recommend some things.
No, I'm just kidding. I know
go to McDonald's.
Right. No, diet's huge. I mean, you have to treat everybody. It's one of my 5 pillars. So I have in integrative and functional medicine, integrative is using Western medicine and all the other medicines, right? So I can write a prescription if I need to and fall back on Western medicine, but I want to use the beautiful herbs that are out there and the other natural means, and that falls into some of these 5 functional medicine categories, one of which is nutrition. And by far, it's one that patients respond to without hesitation. I can say, if you can go on an elimination diet, go on the autoimmune protocol, something like that, there's a good chance you're going to respond positively some way. Now, is it going to relieve your big toe pain, or is it going to relieve your indigestion or your headaches? You often can't tell, and sometimes it's multifactorial, but diet's massive. So one of the things I do is I start out with some big overview, the 1,000-mile categories of how to look at nutrition. I say eat 3 healthy meals a day, 2 healthy snacks, focus on high quality proteins and fats, and eliminate the bad carbs. And then the big question is what are bad carbs, right? So carbs is a terrible category. It's got the bad stuff like breads, pastas, sugars, and then it's got the awesome stuff like the fruits and veggies. And so we want to emphasize the fruits and veggies and de-emphasize the breads and sugars and pastas.
Yes, and chocolate chip cookies would probably fall in the bag.
No, they're the exception.
Okay, good. Well, shoot. All right. Let's see if there was anything. Do you see? So in doing some kind of an elimination diet, do you see everyone or the majority of people react to certain foods, or the elimination of have a response? Are there certain real big triggers that you see most often?
Yeah, there's definitely some foods that you can say more people than others are going to react to, but the cool thing about people, which also makes them really challenging to treat, is this epigenetics. And so it's the environment around us that triggers these different diseases. So I kind of think of everybody having a vessel inside of them. I tell a lot of my patients this, that fills up with the junk that we're exposed to. So the pesticides, the toxins, the GMOs, the antibiotics, the smog, you name it. And then eventually that pot spills over and you get these effects. And as you start taking those toxins down, you're able to adapt better. So maybe your seasonal allergies won't be as bad, or your migraine headaches lessen, or your menstrual cramps, or whatever it is. And one of those ways is I look at foods. Now, there's different types of reactions you can have to foods. You can have a food allergy. It's like you eat a strawberry, you break out in a rash. You can have a food intolerance. That's you eat ice cream and you get gassy and bloated. That's an enzyme deficiency. Or you can have a food sensitivity, and that's a real tricky one. That's an immunoglobulin G, and that can be hours to days delayed before you react to it, or you can have no reaction at all, but internally those antibodies are ramping up, and for the autoimmune patients out there, that's a really bad thing. So by going to these elimination diets and these autoimmune protocol diets, you can eliminate a lot of the insult, get that toxin category down. So, take milk out of your diet. That's an easy one, highly reactive. Take, peanuts, soy, wheat, and its glutens and all those. So you can start taking some big categories out, but the elimination diets that you find on the web are just so helpful to get somebody started. It's an awesome start.
Good. I'm glad you said that, because that's what I'm doing. All right. Either of you, either from the asana practice or the breathing practice any yoga or recommend that to any of your patients? Do you guys ever have yoga?
I don't do yoga on what I'll call a weekly basis, but it is something that I will do. The last time I did it with high frequency, I was in the Dominican, and that was just like one of the perfect things. You're on vacation.
Sure.
You get to do it every day. It's down
On the
by the
beach.
water. And when you talk about really, really like disconnecting and just kind of getting in tune with your body, I think a lot of people think flexibility when they think yoga.
Yes.
I think two big things that I think about outside of flexibility. One, breathing. I love the breathing component. It's something that we're very, very big on with regards to a lot of the maybe early intervention strategies that we're focusing on with people. And then body weight competency. Body weight competency is huge. Everybody wants to talk about lifting weights or using apparatuses, but I find myself and our team finds ourselves trying to teach people how to move and manipulate themselves more often
Yes.
than not. The people that are the most efficient movers are people that move their body the best. So when you have a certain amount of body weight competency, your cost of doing business for all of your daily tasks is much less. If we're more efficient, it's going to take less energy. We're less likely to potentially compensate or do things in a manner where we're struggling to do some of these relatively basic daily tasks.
Yeah, that's awesome.
Yeah, totally agree with you. I like to do yoga. I don't find myself doing it as much. I like Tai Chi. I think that's another, movement, meditation, and a lot of stretch work. And then I do a lot of meditation on my own. I'll either do meditation on my own or I'll use apps to help me,
Mhm.
especially if I can't really focus.
Yeah, the guided meditation.
Love guided
Great,
meditations. Headspace app is one I recommend to all my
It's
patients.
a great app.
Yep.
Yeah.
Definitely.
And then I love 478 breath technique. So I use that, 100 times a day. Dr. Weil was a big fan of that, always had us teach our patients that, and you can Google Dr. Weil 478, but it's, 4-count breathing in, 7-count holding, and 8-count exhaling. And you can do it anytime, right? Nobody has to, you could be doing it right now, I don't even know. So.
Exactly. See, I love that you said that. So when people, and it's exactly what you said, or what, I'm sorry, which one you said. When people think of yoga, they think, and they say to me, oh, I really think I should do more yoga, but I'm just not flexible. And it's that whole, tilting the head, record scratching thing. I'm like, well, how are you going to get more flexible if you're not going to do anything about it? But it's not, yoga is so much more than flexibility. It's the mindfulness when you're out practicing, at the Dominican, and it's the breathing, to me, that are, it's that whole group of things. And when you add those into some movements that you're doing efficiently, it's not all about getting a six-pack, because let's face it, if it was easy, everyone would have one, right? We were saying that earlier. It's about having quality of life. And so, and oftentimes losing weight is something people talk to me about, trying to lose weight, because that's going to bring them better quality of life, because oftentimes if you're carrying entirely too much weight, that's just that whole snowball effect. It's causing joint pain, which is making you not work out or even walk, and then you gain more weight, and then you get depressed, and then you eat bad, and then you eat poorly, so you hate yourself, so you eat more, and it's that cycle that we see over and over again.
If you don't mind, actually, I'm going to touch
Yeah.
on the flexibility component everybody brings up in yoga, and that's great. But I think what we're finding more and more with regards to people becoming limber, the better control you have, the more your body kind of unlocks itself.
Yes.
So when you lack stability or control of yourself, your body goes into this like protective tension mode. And usually what we'll try to do is find analogies for people. If you're thinking about range of motion being a lot like a seesaw, right? If you can't control a lot, is your body going to allow you to have fun on this big seesaw? No, it's probably going to keep things relatively restricted, because
Right.
it knows you can't control these deeper or bigger joint ranges of motion. So I think one of the best parts about the flexibility in yoga is it does take you through these deeper, longer ranges of motion. But what does it force you to do? Control and breathe. And if you can't breathe while you're going into these new positions, maybe that your body hasn't been in a long period of time, your body's going to, piggybacking on the stress response, it's not going to think that you're in a position where you can take that information. It's stressed. stress to activity is not always going to be something that you adapt positively to. So a good thing about yoga is, it takes you into those new positions and forces you to breathe, and your body goes, you know what, I'm okay. I can get into this new position that I've been in a while, and I'm still breathing.
Yes, and all my classes, and every yoga class I've ever taken, there's modifications. Not everyone is going to be able to go into down dog, which is a common pose most people know, and straighten their knees and get their heels to the floor. And when they can't do that, I tell them, it's okay, you may never do it, and it doesn't matter. Your body may not be built that way. Stress, that is like its own topic in and of itself. But you probably could talk to it, but I'm going to ask Craig from his perspective. Stress. What would you consider stress? Because we know there's good stress and there's bad stress. The fight or flight. So how do you see stress? And what would you consider the stressors to be on people that is causing them issues? And I guess I'm asking this way too broadly, so let me turn this over to you before I keep going.
No, I totally get what you're saying. It's a massive category,
Yeah.
and it's a huge focus with every one of my patients is stress and what it's causing to your body. So the way I like to look at things are from an evolutionary standpoint, right? So if you believe we've been on the planet for 100,000 years, or maybe 200,000 years, and you look at our stresses that we've been exposed to over that time period, back 10,000, 100,000 years, our big stressors were putting a shelter over our heads, clothes on our body, and just staying away from that saber-toothed tiger, right? And then the stress of looking for food, finding food. Advance to today, and particularly these last 100 years, and all of a sudden everything's changed, right? We've got cell phones going off in the middle of the night, texts at all times. We've got road rage going on. We've got bosses yelling at us. I'm sure each of us could think of 100 different
Right.
stressors that we're exposed to on a daily basis. And what that does is it sets off our fight or flight, our sympathetic system to respond. Just the same way it did responding to a saber-toothed tiger jumping on us, or the stress of wandering out into the desert. So our body releases epinephrine, or adrenaline as it's commonly called, and that's to get us ramped up to get ready to fight or run away. And then the stress hormone cortisol is released after that. Now cortisol is life-sustaining. It deals with blood sugar regulation, adding and losing weight, mood stability, you name it. Cortisol is involved with that, and without that, you're dead. So what we see is that over the last umpteen years, the last 50, 100 years, people's cortisol levels are significantly dropping. The amount of fatigue that they're being exposed to, or the amount of fatigue that they're experiencing in daily lives. I can't tell you how many people are in their 40s and just have no energy. They come home, they're crashing on the couch. So whatever that is, your body adapts to it like it has for 100,000 years. So a cell phone going off, body doesn't know, is that a saber-tooth jumping on me, or is that me wandering out to the desert? It doesn't know. It responds the same way. Releases adrenaline followed by cortisol, and you go into that stress response, and then you have that litany of fallout, blood sugar instability, fatigue, can't lose weight. How many people do you hear that, I could eat anything I wanted? Yeah, it's just, and why are we having this problem? So that's my...
I think to piggyback on that, something I've always heard, stress is stress is stress is stress, right? So, and how that kind of correlates over to the world that I live in is obviously physical stress is something that I'm dealing more with on a regular basis, but oftentimes I'm trying to talk to people about lifestyle strategies where maybe they can do things to limit other stressful areas of their life in order to have less of this cumulative effect with regards to the physical stressors they're also putting their body through. Sometimes people choose exercises or activities that are very, very high stress in nature, but they're also not accounting for the fact that they're not sleeping that well because they have a newborn, or they're going through a particular strenuous work shift that has them working a little bit more than normal, or there's something going on from a personal life standpoint that is also going on. And that's something that we, from our side of things, have to account for. Otherwise, we're going to be in a situation where we're just focusing on a single area of stress that could be contributing to this overall sympathetic response that could be making them a little bit more likely to experience symptoms which we deal with, which is more pain oriented.
And I think that's what differentiates you guys at Rehab to Perform, that in my opinion, is you deal, even though I'm coming in there because my knee hurts, you're dealing with me as a whole person. You're not going, oh, okay, so your knee hurts, let's fix your knee. You're what you just said, and that, kudos to you guys, and I know you're building a whole team and opening a second office, and that's huge, and we're all very lucky to have you guys growing like that, changing, in my opinion, how physical therapy is being performed, and so thank you.
That's kind of the big picture.
Well, that's kind of leads me into one of the subscribers' questions. If they're unable to see, because you guys are few and far between, and even more so with an actual Western medical degree, so if someone only has a primary care physician to go to, are there some tests you could recommend to them to ask their doctor to perform, or to,
Yeah, well, the good news is if you can make it to me, then for initial face-to-face visit, then I can see you for virtual follow-ups from then on. So I have patients from other states.
That's great.
Yeah, so you just got to get here for the first appointment so we can set up that doctor-patient relationship.
Lizzie's in the UK, so I know she isn't coming.
I have 2 patients in the UK and 1 in China, actually. So yeah, so
Okay, well, all their information is going to be, there's going to be a link down, and I'm saying down below because I see people do that on the YouTube, so it'll be there.
yeah, hopefully it's down below, not up there.
Yeah.
Well, so if she doesn't travel to the U.S. or whatever, she can definitely ask her physician. It's kind of a broad question because it depends, what area are you dealing with? If you look on my website, I specialize in 5 areas. I won't see everybody for every issue. I'm not a primary care doctor because I want to drill down to some of the areas that I'm an expert in. So I do vet a lot of my patients, but to give her a little help, I think you want to, well, first of all, on her own, she should look at nutrition, exercise, sleep, stress reduction. Those 4 right there will give you a lot of data, and you can do your own Google researches. Doctor standpoint, if it's an energy issue, you want a full thyroid panel. I have that on my website also. TSH, free D3, free D4, both thyroid antibodies. Iron is important, and you want upper limits of iron. Vitamins and minerals, you want tested for that. Vitamin D, our standards are low. We want, they'll say if you have a level above 30 that you're normal. I like it above 50. Iron, same thing. If you're running 50, they'll say you normal. For women, I like 90 to 110 for their iron levels. So just to give an idea. Those would be the main ones, and then I know there's functional medicine doctors in the UK and around the world. It's just you're going to have to do a little bit of research.
Yeah, absolutely. And most of the people that I know that have autoimmune have done a lot of research. Let's see. Josh, does physical therapy have a positive impact on reducing the pain associated with arthritis?
So I think that's kind of like there's gonna be a 2-part answer to this. One, it's like arthritis. Well, I think of joint inflammation, right? Typically, along with that diagnosis, you'll have some discomfort or swelling that another medical professional will have had to have seen in order to give somebody that. Now, also, we're gonna see situations where that diagnosis might get tagged on somebody who reaches a certain age, and they just happen to be having knee pain, and you go, all right, well, this person is this age, and I'm going to say that they have knee pain. So a big part for us, once again, getting back to the assessment process, what can we do to rule in or rule out limitations, asymmetries, and then the abilities and inabilities? What we'll be able to do is we'll be able to tease out things a little bit more with regards to the movement system as a whole. We'll be able to look more specifically at things that you can do or can't do, and then give general and specific recommendations for what you're going to do outside of the office. So if I'm talking about arthritis in particular, things that I think are big rocks, I'm always trying to talk to somebody about pushing them in a direction with regards to eating differently. We're probably going to talk about doing some lower level aerobic work, oftentimes developing a certain base or having maybe even a certain target resting heart rate that we're going to try to have them work on in order to get their whole body a little bit more efficient. So working on the relationship between the parasympathetic system and the aerobic system, and that being an important marker for just overall long-term health and getting your body in a situation where it's less likely to be symptomatic. Talking about things like soft tissue work, whether or not you're going to get soft tissue work at our place, at a massage therapist, teaching people how to use stuff like a roller or a lacrosse ball or something along those lines. And then really, the biggest thing is telling people where their body's at now, what they can do differently in order to get their body to the end goal or the end activity that eventually they want to get to. And there's a way to do that. So it's unfortunate sometimes when people have been given these diagnoses, they have certain associations for the diagnosis, and it's almost like a death wish. And their activity level drastically decreases, and they feel like, oh, I'm got arthritis. When in all reality, you might have just hit a certain age marker, and somebody might have just been a little bit short-sighted with regards to telling you what you can and cannot do.
Yeah, absolutely. So you brought up sleep. That was one of them. Actually, one of them was just advice on dealing with fatigue, and then like 3 other people chimed in. They're, yes, what about sleep and sleep quality? So sleep is huge, I know that. But quality of sleep, because you can have restful sleep and not restful sleep.
Sure. Well, sleep, just to start out, sleep is one of the most difficult things to affect. And I find that usually it'll take months of work with people to try and improve their quality of sleep and get them into a more restful state. But there's a lot of things you can do right now to improve it. We call it sleep hygiene, or setting yourself up for good sleep. And it's getting into good habits. So a lot of people have some bad habits. One is going to sleep with the TV on. So really, the TV should be kept out of the bedroom. The bedroom's only supposed to be for sleeping and sleeping, right? So we keep the TV out of there. You can read some books, but a lot of the blue light, there's blue light blockers, goggles that people have started using. A lot of people will set themselves up with habits like taking a shower or a bath before they go to bed to start getting them into that relaxed mood. They'll drink chamomile tea, something that has some positive effects on their body to start calming it down. And then I get asked a lot of times about medicines. What can you do? And I'm not a big fan of, I'm definitely not a fan of any of the narcotics. And then there's the things like Ambien that I'm also not a big fan of because it affects your later stage sleeps and your REM sleep. So I use something simple like melatonin. Now, some of your viewers are going to say, try melatonin, doesn't work. And I've tried a lot of different melatonins and found the same thing. And the most common reason is melatonin only lasts for about 90 minutes in your body. And so if you go to bed at 10 o'clock, so a good sleep schedule is 10 p.m., 6 a.m. So if you go to bed at 10 p.m. and you take a melatonin, it's only in your body till 11:30, maybe 12. And so everybody's asking, well, why am I waking up at 1 or 2 in the morning? I took my melatonin. Well, that's why. It's out of your system. So I actually use a spray melatonin so that you can take it at bedtime, and then if you wake up at 1 or 2 in the morning, you can spray again. You don't have to pop a pill, open the cap and do all that. And so it's been a really nice help. Now, melatonin's safe. Right? Your own body produces melatonin. You only need small quantities. These 5, 10 milligram dosages don't have any, there's no study showing there's any benefit to going up in those dosages. So, and then I guess the final part to wrap up with sleep would be I do a lot of work with adrenal fatigue, which you mentioned, a lot of people are tired. And I find that once I start treating their adrenal fatigue, which is related to that cortisol we talked to at the beginning, their sleep starts improving naturally. Their body wants to get that. And I get the comment, man, it's the first time I've slept more than 5 hours, in a row in 8 years. And they'll still feel tired, but man, the body is catching up from years of abuse.
Yes, so. I'm sure it's not an overnight process.
No.
Yeah, and if you don't mind, I'm going to just piggyback on that and some of the stuff. we're very similar, right? We're business owners, and you go, 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 and I'm not a parent yet. Obviously, I can't relate to that aspect of things, but when I think of sleep, just being able to regenerate and recover. So I think of everything from being more efficient with regards to the physical activity that I might be putting myself through. I think about being able to be more present and more connected to people in terms of not having this brain fog that I typically associate with being tired. And just some little things, and I guess one of them is probably more of a question for you. Zinc and magnesium, any thoughts about that before bed? Because that's been something I think that's been beneficial for me with regards to mineral supplementation and making sure that that's
they support that. So, absolutely. And magnesium's got the added benefit. Not only does it help you with sleep, it also helps you with GI regularity too.
Mm-hmm.
So a lot of people take that at night to get a benefit from both standpoints.
Right.
But yeah, absolutely. And I personally supplement with a little bit of extra zinc and magnesium in my diet. I do test my levels to know what healthy amounts are, but more often than not, most people are deficient in this stuff. I always get asked, can I just eat a healthy diet? Can I just get it from my food? And
and that'd be nice if we could.
Yeah, it would be, but there's studies out there that show the apple of 50 years ago is not the apple of today. They're depleted. They don't have the same mineral contents. A lot of things are 20%, 30% deficient, and so you really can't get the same stuff that your grandparents could get.
Right. Yeah. That's a whole nother. I'm big on that. So, and you just started to touch on that a little bit. Reba asked, I can't afford one or any tests right now, so my question is, which nutrients and supplements are dangerous to take if you're not deficient?
I think I can say this generally, that most people are safe taking a high quality multivitamin. So, decide what you think's a good representative and find a good quality that you can, depending on where you live, what part of I guess the UK or the US. Yeah. And then, purchase a good multivitamin and take that. And I think you'll start building up some levels. It's got a good B complex in most multivitamins, so you don't really need an extra B complex on top of that. Most vitamin C's are in the multivitamin. It's pretty hard to overdose on C, but at the same time, most of the studies aren't panning out that there's a lot of huge benefits from high dose vitamin C, like Linus Pauling.
With the cold and all that.
Yeah, they show a little bit, but I'll be honest, if I feel cold coming on, I pop some vitamin C and some zinc right away to try and get a little bit of boost. I'd say the only thing that I wouldn't overdose on, I guess vitamin A can be dangerous at high levels, and I've seen a lot of people come in taking 10,000 IUs of vitamin A a day, and that can definitely lead to toxicity. And then I've seen one person that overdosed on zinc, of all things, and lost her sense of taste. It was that, I want to say it's like airborne or something like that.
The cold ones?
Yeah.
When you have a cold? Yeah. I know what you're talking about.
She took way too many of them for
They're
too long.
nasty. I couldn't do that. I couldn't do it.
Yeah.
Okay. But what about D? I've heard D.
Oh yeah, D is awesome to take, and I can guarantee, I test everybody for D, and I've never found anybody that's met my level of 50 that I had mentioned before. I find plenty of people, that are at 25, 30. I find a lot that are down at 12 or 18 that are really hurting and need that extra boost. So D is a safe one. You want vitamin D3, you don't want D2. So that's a big one for absorption reasons. And then the other thing you want vitamin K2 with that D3, so vitamin K2. And that's because that helps drive the calcium that you take up in your diet into your bones and keeps you from excreting it out your kidneys. So,
okay.
A little tidbit on that.
That's awesome. We kind of touched on this earlier, but how detrimental do you think GMOs and
Glyphosate?
Yes, thank you. Are to autoimmune disorders?
So bad Monsanto is what your person is getting at, Monsanto and their Roundup Ready, right? And they're terrible. They really are. They're huge chemical disruptors in your body. They're splitting off DNA fragments. They're just this whole toxic thing that we talked about at the beginning, where we're filling up that bucket of toxicity is happening, and that's a major component. They're a bad chemical to get exposed to. You can read the millions of reasons, but you want to decrease those toxicities. So I'm a huge fan of eating organic, grass-fed sources, local, wild caught salmon. I always tell everybody, they're like, oh, I can't eat farm salmon. When's the last time you saw a salmon out there munching on a corn cob? Right? Well, that's what they get fed.
Yeah.
And the corn, most of our corn in this country is being treated with Roundup Ready, meaning that it's getting sprayed with that glyphosate. It's getting into it, or it's genetically modified to tolerate that. So you're getting that genetically modified, and it's going from corn to salmon to you, and it's building up these toxicities. One of the cool things I always like to tell my patients is they ask about this epigenetics that we talked about, this environment about us, to understand it better. And I tell them a little, one of the studies I really liked was they took identical twins, or studied identical twins, that were separated at birth and raised, one, like West Coast, one East Coast, and followed them to see what happened. Now you would think identical twins would develop their diseases at the same time, right? If they're going to develop Crohn's or ulcerative colitis or rheumatoid arthritis or whatever autoimmune, if it was going to trigger at age 20, both would trigger, right? But one triggers at age 15, one triggers at age 50. And why is that? It's what they're exposed to. Again, California, much more protective, more laws. They're really trying to get rid of all that, the glyphosates and the GMOs, versus out here on the East Coast, we're not quite as progressive. And so people are being exposed to it. So it really does matter, this bad chemical exposure.
Good. Well, I think that is it. And as I said earlier, there'll be links to both Rehab to Perform and to Hauser Health somewhere below. And I thank you all for watching, and I hope you find this helpful.